Scleroderma is an autoimmune deficiency disease that gets its name from the Greek sclero, which means hard, and derma, which means skin. Most visibly, scleroderma hardens skin, but this disease is not merely an external illness, and the disease can be expressed in many different ways.
Scleroderma covers a spectrum, and which, like a lot of diseases, like hypertension or diabetes, so it is a sort of disease where you can have a touch of it, or you can have a very severe and complex form of it.
There's a problem going on in the collagen called fibrosis, and as fibrosis progresses, you get tighter skin, harder, what should be very supple organs like your esophagus and your stomach and your kidneys, liver. It can be almost anywhere in the body. It starts to harden as the fibrosis continues.
There are 4 different types of scleroderma. Under the general umbrella term of scleroderma, there is localized and systemic, but under localized there is localized morphea and localized linear. These forms of scleroderma are often found in children and can be treated and cured. But under systemic scleroderma, there is limited and diffused. These are much more harmful forms of the disease. But the difference between limited and diffused is still very great, and they can almost be seen as 2 different diseases.
So limited disease derives these names from the extent of skin thickening. So people with limited disease will never have a lot of skin thickening. So the skin as a target doesn't require treatment. And their disease tends to progress very slowly. So they may have symptoms that need treatment as far as Raynaud's or reflux or other gastrointestinal complications. Or after many years, they can develop a complication called pulmonary hypertension.
So you're going to have the sensitivity to the cold, the Raynaud's, which is vascular spasming. I had that. I had my fingernails start to change. No one ever talks about that, but that was one of my symptoms.
I started having a lot of issues with food, and what would happen is I wouldn't digest the food properly, and I would get what they call a pseudo blockage. It's not really a blockage in that it will eventually pass, but until it does, you continue to try and digest it, and you end up throwing up a lot, and you have to get to the hospital to get on an IV so you don't get dehydrated.
Diffuse disease is almost a different disease. It can, because the character of it is so different. The symptoms may be shared as far as they also get Raynaud's, they also get reflux. But the pace of the disease is what differs the most. They can change from 1 week to the next, certainly from a month to the next, whereas individuals with limited disease can go years without changes being seen. So in my own mind, I think of scleroderma as a disease that's like a highway with several different lanes. And those people I talked about first, with a very slowly progressive disease with maybe just Raynaud's and reflux, they're way over in the right lane. They're almost in the service lane. Their disease isn't going to go anywhere fast. And lane changes don't generally occur. What I will say about those people in the fast lane is it's not like it just keeps going, keeps going, keeps going. The disease eventually runs out of gas. And in most people, there is a period of activity of 3 to 5 years, and in which time there may be new organ involvement, there may be progression of skin thickening, and then even without any treatment, in the majority of those individuals, they'll reach a plateau, and then the skin will soften and new events will stop happening. So they need aggressive therapy for a period of time, and then afterwards they don't. And what we try to do with the medications is minimize the storm damage. So I tell people, you may be in a rough ride and have to take a bunch of medicine for a period of several years, not weeks or months, but several years. And the whole goal of being so aggressive is so that when you kind of come out at the end of the wash cycle or the hurricane season, that you can say, I survived pretty well.
Rosa Johnson and Pete Hunt both have systemic scleroderma, but the way that their scleroderma affects their bodies differs greatly. Rosa Johnson has been fighting diffuse scleroderma, the much more aggressive form of the disease, since 2001.
Scleroderma is a chronic illness that has impacted my lungs, my skin, my esophagus, my digestive system, and my joints, you know, my life.
Before Rosa was diagnosed, she went to see her primary care doctor and explained how she had difficulty getting out of bed and was bent over when trying to walk first thing in the morning. He replied, saying it sounds like scleroderma, but I wouldn't wish that on anyone.
I just shut it up because he said it sounds like, so I didn't take it serious.
But after the doctor ran all the tests, he was right. Rosa had scleroderma. She asked him on a scale of 1 to 10 how severe her case was.
And he had told me a 7. So that's going to scare me, because a 7 is on the other side of 5, and that's serious.
Rosa believes that the disease was most aggressive in her digestive system early on. She lost a lot of weight because her body wasn't absorbing the nutrients from the food. Before she was sick, she was a size 20. Now, she's a size 4, and her clothes are big on her. She's lost so much weight, her doctors want to put her on a feeding tube to ensure she gets the nutrients she needs.
I'm not mentally ready for that. The doctors are telling me how it's supposed to help sustain you, give you the nutrition, and all that. But yet, the people that I know that have done it, they're not here.
In most patients, diffuse scleroderma is very active early on. There can be major changes to the body over the course of just several weeks. Pete Hunt was diagnosed with scleroderma even before Rosa, but has the less aggressive limited form of the disease. But limited does not mean easy.
Probably in February of 2001, I played hardball, and we had starting spring practices up, and I couldn't pitch. I couldn't get anything on my fastball, and my shoulder hurt, and I didn't know why. It wasn't because I had pitched too much, it just, something wasn't right. And I went to my primary care physician, and he didn't think there was anything wrong.
Luckily, Pete's wife insisted that he go to her doctor to get a second opinion. The new doctor knew that something was wrong, but didn't know exactly what. The doctor suggested Pete see a specialist.
I made an appointment with Dr. Metzger in Pittsburgh, UPMC. And the day before Thanksgiving that year in 2001, we went down to Pittsburgh, and within 5 minutes, he confirmed that, yeah, just by touching my skin and feeling the thickness of my skin, that I had scleroderma.
Those specialists look at the hands of the patients. They may see several different things that would point to scleroderma before any blood work is done. Some thickening of the skin, which is called sclerodactyly, due to extra collagen in the fingers, making them thick or taut. The patient's fingers are often cold all the time. One of the characteristics of the disease is Raynaud phenomenon, where the patient's fingers are white or blanched. Less common symptoms would be calcium deposits or sores at the fingertips.
If you have Raynaud's phenomenon and you have sores at the fingertips, you almost always have scleroderma, less commonly calcium deposits at the fingertips. So these are all things that would be apparent by visual inspection or palpation of the hands.
If a patient is experiencing symptoms, they will go through a variety of blood tests, some of which do come back as positive. The hands are important, but it's a combination of seeing visual symptoms and positive blood tests that will result in a scleroderma diagnosis.
If they don't have any symptoms that fit with the blood test. If the blood tests are not that specific, none of them. And they are, it's just like Lyme test. If someone has no symptom of Lyme disease but has a positive Lyme antibody, we can't say they have Lyme disease. You need something to go along with the blood test.
Currently, scleroderma research is in its infancy. The medical field is getting better at diagnosing the disease, as well as developing better treatments. However, they don't know what causes it. But there are theories.
Environmental factors are probably important. We are investigating now a cluster of 4 people in one school who over a period of time develop scleroderma in adjacent classrooms, and that just shouldn't happen by chance. It's just the number is way too great.
They believe there's an environmental trigger. You have a genetic disposition for it, and then there's an environmental trigger. And where I used to work, I worked around silica. We made glass-lined tanks. There was a lot of dust. So I think maybe that was the trigger, because the silica, even on the MSDS, Material Safety Data Sheet, it says it may cause scleroderma.
I went to my physician complaining about the Graves' disease, and they decided I needed the treatment for Graves', which is radioactive iodine. I had the treatment done. Within a week, I had no salivatory glands or tear glands, so they diagnosed me with Sjogren's. But today we know radiation can be a trigger factor.
In Rosa's case, the doctors believe that something was lying dormant inside her, and the scleroderma was triggered by a traumatic event. Rosa was in a fire in 1998. She had first-degree burns on her face and hands. The doctors believe that the trauma of the fire and the use of morphine were then triggers for her. August of 2001 was when the noticeable signs of the scleroderma started presenting itself. The Tri-State Scleroderma Foundation works with patients, doctors, and volunteers in New York, New Jersey, and Connecticut. They help cities create support groups as well as train individuals to be support group leaders in their communities. In addition, Tri-State connects patients with physicians in their area who have experience with scleroderma.
Part of what I do in patient education is to start support groups. So support groups are our eyes and ears in the communities that we serve, which is 3 different states, so you kind of have to extend yourself out into those communities.
So we want to do something and say something that's going to uplift them and allow them, when they leave out, between the time that they leave and the time that they come to our next support meeting, that they feel, all right, I've got something of value, I've learned something new, this is a welcome group, you know, they're genuine and they really care about me.
With scleroderma, I mean, you're going to have some times where you get depressed, you know, why me, and just not good. But if you lean on your support system, your family, you know, you'll pull through.
They're not alone, and that's a big part of what we do. We want patients and families to know that they're never going to be alone. We're going to be here for them.
I've got a really close family to begin with, but I think it brought us together more. They gave me a lot of support. But I'm really lucky compared to a lot of people.
And unfortunately, a lot of our members or patients do not have family members, and a lot of them are seniors. And so therefore, I take the initiative to reach out to them to see how they're doing and find out what their needs are and try to help them.
When I first got sick, I thought I was going to be dead in 2 years.
That's going to be hard.
Sorry.
No, you're fine.
As a scleroderma patient, it is incredibly important that you educate yourself about the disease. According to the Tri-State Scleroderma Foundation, many doctors will never see a case of scleroderma, which makes it hard to find a knowledgeable doctor, even when the signs of scleroderma are obvious.
And that's because a lot of doctors are not familiar with this disease. So sometimes the patient is misdiagnosed. At no fault of the doctor just does not know enough about this disease.
My suggestions to people that are newly diagnosed or they think they might have it is to learn as much as you can about it, talk to people, join a support group. You have to be your own advocate.
One of the best ways to educate yourself is through the Scleroderma Foundation website at scleroderma.org. There are also many informational videos at sclerodermavideo.com. These websites will help patients to better understand their disease and see that they are not alone.
There is so much knowledge now that I never had when I was first diagnosed. And that can be a resource to complement the treatment that you're getting wherever you are.
I started reading a lot about it online, in books. My parents read a lot about it. I distinctly remember one book that my parents got where at the time, if you were diagnosed with scleroderma, 2/3 of the people were dead within 2 years. So I thought it was a death sentence at the time.
People have to recognize there is this huge spectrum. So it's just like being told you have high blood pressure or that you have diabetes. Sometimes those can be life-altering. Sometimes it can mean you just have to make diet changes or lose weight or exercise. So scleroderma doesn't need to be, often isn't a life-changing event.
Don't let this disease define you. Keep living.
And I've never quit working because of the disease. I still work, all the time. I'm still active. And I had the 2 years where I was depressed and I really didn't do much when the disease was a lot more active and attacking my body. My skin was a lot tighter. Even my skin's gotten a lot better as far as the thickness, even in my hands.
Live, how to put this in, live, laugh, and love, however the order, but don't stop.
It's a tough illness because not that many people have it, and it's I never heard of it before I got sick.
Keep moving forward until you can't move forward no more.